Everybody, I apologize. We're running a few minutes behind here today. You good to go? All right, great. I am pleased to call to order the October 7th, 2021 meeting of the Montgomery County Board of Commissioners. Note the presence of all three commissioners, and I'm going to ask Dr. Lorraine to lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, I have a few opening comments. First, I want to begin with Hurricane Ida recovery. The county continues to lead a multi-departmental effort to help our communities recover. Later in the meeting this morning, we will hear a comprehensive update on these efforts from a number of our county team that are leading this work. However, right now, I do want to remind residents that our Disaster Recovery Center, or DRC, does remain open Monday through Saturday to assist you with the disaster recovery process. The DRC is located at the Bluebell campus of Montgomery County Community College in the Health Sciences Center gym. Recovery specialists from FEMA and the Small Business Everybody, I apologize. We're running a few minutes behind here today. You good to go? All right, great. I am pleased to call to order the October 7th, 2021 meeting of the Montgomery County Board of Commissioners. Note the presence of all three commissioners, and I'm going to ask Dr. Lorraine to lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, I have a few opening comments. First, I want to begin with Hurricane Ida recovery. The county continues to lead a multi-departmental effort to help our communities recover. Later in the meeting this morning, we will hear a comprehensive update on these efforts from a number of our county team that are leading this work. However, right now, I do want to remind residents that our Disaster Recovery Center, or DRC, does remain open Monday through Saturday to assist you with the disaster recovery process. The DRC is located at the Bluebell campus of Montgomery County Community College in the Health Sciences Center gym. Recovery specialists from FEMA and the Small Business Administration are available to assist homeowners, renters, and business owners in applying for federal aid and answer your questions. We encourage anyone who's been impacted by this storm to visit our webpage at www.montcopa.org/Ida for these updates and other information. This page continues to be updated daily. Even if you have already applied for assistance by phone or online and just have questions, you can go to the DRC for in-person assistance. So far, more than 4,300 Montgomery County residents have applied for aid through FEMA, and each day more funds are being distributed through individual assistance. However, we know there are gaps in funding, and this is why the county is committed to making sure that we are supporting Ida victims for now and for the long term. We recently launched a comprehensive needs assessment to connect impacted residents with services to take care of any unmet needs. We are working with hundreds of displaced residents directly to provide food, clothing, transportation, and more. This needs assessment is also linked on our IDA webpage and has been shared with our network of nonprofit partners to make sure we are reaching additional households. The Montgomery County Emergency Disaster Relief Fund, hosted by the Montgomery County Foundation, continues to solicit donations to support nonprofit agencies serving individuals and families impacted by the remnants of Hurricane Ida. Funds can be used to support housing, food, gasoline, and household needs such as cleaning products, hygiene products, bedding, towels, and clothing. You can donate to the Montco Emergency Disaster Relief Fund online, by text, or by check. We thank all of the local businesses and individuals for their support. The fund has currently received more than $157,000 in donations, but certainly more could be put to good use. Information about the fund and a link to donate can be found on that main IDA page, moncopa.org/IDA. In addition, a number of organizations in and around the county are accepting physical, non-monetary donations, which they in turn will provide to individuals in need. This includes donations of clothing, toiletries, furniture, food, household goods, and more. Contact information for each organization accepting physical donations is on that same webpage, moncopa.org/IDA. And again, I just want to thank everyone who is still actively engaged in helping our communities recover and continue to and share our sorrow for all of those who've been so desperately impacted by this storm. Now, quick update on our current COVID-19 status here in the county. The Delta variant remains with us, and I want to be very clear that the vast majority of new cases are occurring in unvaccinated individuals. Little bit of good news today. For the first time since the summer, we saw a positive improvement across our 3 core COVID-19 metrics here in the county. Our total 7-day average decreased for the second week in a row, coming in at 127.7 cases. That is a slight decrease from last week's total. And our 14-day average similarly dropped slightly, down to 136.6 this week. We've also seen for the second week in a row, our 14-day positivity rate dropped slightly. It is now at 5.17%. So all of these numbers are higher than we would like them to be, and we still remain in a situation of high transmission because of the number of cases per 100,000 residents that we're seeing, but at least we are moving in the right direction. A lot of this is happening, this good news, because our vaccination rates continue to increase. We had more than 5,000 residents receive their first dose of vaccine this past week, which is fantastic. Overall, we are now at 82.69% of eligible Montgomery County residents. That means those that are 12 years of age and up, having received at least one dose of the vaccine, and the vast majority of those are fully vaccinated. My hope is that as additional individuals get vaccinated, and we will be able to keep these positive trends going. I again urge anyone who hasn't been vaccinated to please do so. It is the single most important thing that you can do to help slow this pandemic. Our 4 vaccine clinics are open 5 days a week with varying hours to make it as convenient as possible to get vaccinated. And remember, it's no cost. You do not need a doctor's order or anything like that. Just show up and we will be happy to vaccinate you. We have the Moderna, the Pfizer, and the J&J vaccine at our county-run clinics. And we also began offering Pfizer booster shots last week, in addition to flu shots. And we'll talk more about flu shots in a little bit. Finally, I want to remind everyone that we have no-cost COVID-19 testing. Continues to be available at our 4 sites across the county. And due to demand, we are opening a 5th testing location at Green Lane starting next week. Again, thank you to everyone who's done their part, who's getting vaccinated, who's wearing a mask indoors, who's taking all the steps that we need to take to help keep our community safe. And that's a perfect segue into my final set of comments, which is to recognize some true heroes in our midst. And that is our Montgomery County Office of Public Health team. The Montgomery County Office of Public Health is one of only 6 county public health departments in the Commonwealth, and we just marked their 30th anniversary last Friday, October the 1st. I want to acknowledge Dr. Lorraine, who is our medical officer for our health department. And Christina Miller, who's not here, is our administrator for our health department. The health department supports the county government's role with disease surveillance and prevention and community safety efforts, including testing, immunization, emergency preparedness, contact tracing, water quality, and environmental and food and drinking establishment regulation, maternal and child wellness services, and more. And as many of you know, the Office of Public Health has been instrumental in the county's management and response to the COVID-19 pandemic. They track and respond all emerging public health matters that may include infectious disease outbreaks, environmental health threats, and promote the prevention of chronic diseases within our community through health education. Much of the office's critical work includes upstream prevention, with the goal of addressing in an equitable way the underlying conditions in a community that contribute to poor health and health disparities, and to improve the outcomes and quality of life for underserved populations and the community as a whole. The Office of Public Health works closely with multiple county departments, hospitals, schools, congregate care facilities, faith communities, other county public health departments, and state and federal environmental agencies to share information, identify trends and outbreaks, slow the spread of disease, and investigate sources of infection for all communicable diseases. Their work with the medical community, residents, elected officials, community organizations, and state and federal agencies is essential for making policy recommendations and implementing solutions to support the overall health of our community. I want to thank all of our OPH staff for the work they do every single day in our communities, while on top of it, continuing to respond to this COVID-19 pandemic. These folks have been working pretty much 7 days a week now for well over a year and a half. They are tireless, they are committed, they are absolute heroes, and they are true public servants, and we are so grateful to have them as part of our county family. So congratulations on this 30-year anniversary. That is quite a milestone, and we look forward to many, many more wonderful years. Thank you. Yep.
Good morning. Today I have a specific and general update on the upcoming election. Last week we were notified that approximately 16,000 general election mail-in ballots were printed incorrectly by our ballot vendor, NPC, and mailed to residents. These ballots were only printed on one side, which left off the ballot questions on the back side of the ballot. Our printer, NPC, has taken full responsibility for this error, but I want to say that this should not have happened. It's unacceptable, and everyone involved in the process needs to take accountability and ensure that this does not happen again. Voters who receive a one-sided ballot in the mail should destroy the ballot and envelopes. Our Voter Services Office has canceled the incorrectly issued ballot materials and will mail new two-sided ballots to these residents automatically. Any affected residents have been notified by email, phone, or mail. I can confirm the reissued ballots have been reprinted correctly and will begin going out in the mail today. As always, any voter who originally applied to vote by mail but chooses not to return their mail-in ballot can vote in person. To do this, you can surrender your ballot in the envelope with the voter declaration at your polling location. If these ballot materials are not presented, you can vote using a provisional ballot. And residents with questions on this can submit a request online at www.montcopa.org/voter-services or call at 610-278-3280. And I just want to say again, when the sanctity of our elections are being questioned daily, we have to get this right, and we are going to get this right. The 2020 general election will take place on Tuesday, November 2nd. In this election, voters will be selecting local officials such as county and city officials, including supervisors, council members, mayors, and tax collectors, judges and ministerial district judges, school board members, and polling place election officials and constables. Voters will have the option to cast their ballot in person, by absentee ballot, or by mail-in ballot. Regardless of which option you choose, you must be registered to vote by October 18th, 2021. That means your registration must be received by Voter Services on October 18th at 11:59 p.m. when the online portal closes. Postmarks do not apply. The last day to request a mail-in or absentee ballot for the November 2nd election is October 26th. If you're not sure if you applied to vote by mail or applied and now want to vote in person, check the absentee and mail-in voting sections of the Voter Services website to find the answers to your questions. We will be using secure drop-off locations once again. They will be in the same locations as in the primary election, and a full list will be available on the website soon. The drop boxes will be available from October 16th until November 2nd at 8 p.m. when the polls close. Final polling locations will be posted online on October 15th. We will be sending letters to anyone whose polling location has changed and encourage everyone to check their registration information ahead of the election. Voter Services will open satellite offices in Lansdale, Lower Merion, Pottstown, and Willow Grove to serve our residents directly in their communities. These locations will assist voters with registration or any other voter-related services. Satellite offices will be open on the weekends of October 16th and 17th and October 23rd and 24th. Voters can also visit Voter Services on the 6th floor of 1 Montgomery Plaza Monday through Friday during business hours. All polling locations will be following Montgomery County COVID-19 public safety protocols during the election. We will continue to utilize social distancing and hand sanitation, and poll workers will be wearing masks. We encourage all residents who wish to cast a ballot in person to follow the posted rules of the polling locations regarding masking. The Voter Services website is a great source for all the information I've already mentioned, including running for office, registering to vote, voting instructions, and working as a poll worker in upcoming elections. It's also the place where all county election results are posted. Please visit www.montcopa.org/voter services for more information. Thank you.
Yes, good morning, everyone. I would also like to provide comments regarding the 16,000 incorrect mail-in ballots that were sent out to Montgomery County voters. This error took place is another example of Harrisburg's disastrous and unconstitutional Act 77, no excuse mail-in voting law, which continues to wreak havoc on Pennsylvania elections at the state and local level. Over the last 2 years, I've been very critical of mail-in voting, and I'd like to explain to the public how mail-in voting came about here in Pennsylvania. A lot of people believe that mail-in voting came about because of the coronavirus, but the mail-in voting legislation in Pennsylvania was actually enacted before the virus in 2019, and it was legislation called Act 77. And Act 77 is 50 days of no-excuse mail-in voting, meaning there's almost a 2-month window before Election Day to vote by mail without an excuse. And that window of time is greater than any other state in the whole entire country. And the state legislatures are responsible for creating the state's election laws. And here in Pennsylvania, we have a Democrat governor, but we have a Republican majority in our state Senate and state House, our state legislature. And there was a deal cut to get Act 77 passed. And the way it was cut was unconstitutional. So in Article 7, Section 14 of the Pennsylvania Constitution, it lays out parameters for absentee ballot voting. This new language through Act 77, with the mail-in voting language, changes those parameters. In doing so, that triggers a constitutional amendment. And a constitutional amendment has 2 requirements. It has to pass 2 legislative sessions. Act 77 only passed 1 legislative session. And it also requires a voter referendum on the ballot, a yes or no question where the voters decide on Election Day whether or not they support that amendment. And obviously that never took place. There's a whole process where at least 2 newspapers in all 67 counties are supposed to advertise this. That never happened. And there's actually a former state senator who's retired since, but he was there at the time in 2019 when Act 77 was passed. And he sent out an official memo to the entire Pennsylvania State Senate informing them that what they were proposing in Act 77 triggered a constitutional amendment and that there's a specific process they need to follow. And they knowingly and deliberately disregarded that memo and moved forward, passing it unconstitutionally. And this legislation was unanimously passed by every single Republican state senator. The Democrats opposed it. But at the end of the day, the law has to be signed off by the governor. And there was a deal made. And the deal made was the Republicans in the legislature said, we will give you 50 days of no excuse mail-in voting if you allow us to remove straight ticket voting in the general election. And if everyone recalls, when we voted on November 3rd, that was the first time where our general election ballot no longer said straight Republican or straight Democrat. That was a trade-off. And it was a political stunt where politicians know that in masses, voters are less likely to go all the way down ballot It'll keep down ballot races safer seats, but it also secures the top of the ticket race for the Democrat Party. So in their eyes, it was a win-win for both political parties, and it was a political stunt that's costing taxpayers money, and it's ruining the integrity of our election process here in Pennsylvania. And I've been outspoken about this since this occurred in 2019. I've opposed every contract associated with mail-in voting. I'm obviously outvoted 2-1, but I do that to educate the public on how this should not have taken place in Pennsylvania, and the way it was done was wrong, it was unconstitutional, and we are now suffering the consequences. This last contract I opposed last year was $2 million for a one-year contract, and right off the get-go, 16,000 incorrect ballots were sent out. That's totally unacceptable. But this isn't the first time. Last year, another company that handled our mail-in ballots, located in Ohio, they had a fiasco delivering ballots to Montgomery County voters. Some Republican voters in the primary of 2020 received Democrat ballots. Vice versa, Democrat voters received Republican ballots in the primary. Some people received ballots that weren't connected to their geographic location. It was another area of the county. It was a total fiasco. So there's a pattern where massive mail-in voting is not effective. It creates many problems, and it's also very costly. Mail-in ballot drop-offs that's something we never had before Act 77. That's another additional cost. We also have to have sheriff deputies travel around the county to pick up ballots and bring them to a mail-in voting counting center that we never had before Act 77, which also costs millions of dollars in machinery, equipment, scanners, machines to extract the envelope from a ballot, service contracts to handle this new equipment and machinery, a lease agreement that's increased significantly because of this. So I will continue to oppose every item associated with mail-in voting because I believe it's detrimental to the integrity of our election process here in Montgomery County, here in Pennsylvania. And I encourage all voters in Montgomery County, first of all, to vote, exercise your civic duty to vote. But the most secure way to cast your ballot is in person on Election Day. And I encourage everyone in Montgomery County, to the best of their ability and their physical capabilities, to cast their vote in person on Election Day. That's by far the most secure way to make sure your vote counts. And I know there's an item coming up on the agenda today. It's contract award number 1. That's a service contract for a scanner for mail-in ballots, and I'll be opposing that. So again, please vote in person. Thank you.
Okay, we will now move on to public comment, and we will begin with the public comment on matters appearing on the agenda. Mr. Stein, why don't you just go ahead and read the rules for public comment, and then we'll sort out who's here for what.
Absolutely. Good morning, everybody. All speakers that are present should sign in on the sheet available in the back of the room. Those online should raise their hand, as indicated by Ms. Francisco. Speakers should come to the podium if they're physically able. All speakers should identify themselves by name and municipality. All public comments must be relevant or germane to county business. Under the law, this means that the subject matter of all comments must be limited to items or issues which are currently before the commissioners for consideration or which may come before the commissioners for consideration at a future meeting. Whether a matter is germane to county business is a determination to be made by the county solicitor. Profane, slanderous, or discriminatory language or comments will not be tolerated in accordance with the county's non-discrimination policy. A time limit of 2 minutes will be monitored, and county staff will respectfully request speakers to conclude their comments if the speaker goes beyond the time allotted. The board is not required to respond to public comments during the course of the meeting, so the public is reminded this is not an opportunity for dialogue or questions and answers. The board chair may direct appropriate county staff to follow up on any questions or additional comments after the meeting. Disruptive behavior, including, but not limited to, yelling from the seats, arguing whether matters germane to county business once the solicitor has made a determination on such, refusing to yield the floor once time has elapsed, being requested to sit down, or otherwise attempting to disrupt the meeting in any way, shall be grounds for removal from the meeting without further admonishment or warning. And as always, the commissioners welcome written correspondence, comments, and feedbacks at commissioners@montgopa.org.
Thank you, Mr. Stein. All right.
Okay, we'll
Should we
start with
start in the room?
anybody
Yeah.
in the room who has public comment. Okay.
And is this for something on our agenda today? Okay, then that'll be the next section, yeah.
All right.
All right.
And then for anybody who is logged into Zoom, if you would like to provide public comment, you just use the raise your hand feature. So we'll just give it one moment for that.
Now, we'll move on to general public comment. Same set of rules apply. Good morning. Come on up to the podium.
And then just speak into the.
Welcome.
We're coming.
That's totally fine.
Okay. Hello, Commissioners. My name is A. Pitts, and this is Little Pitts. We are the wife and son of Sergeant K. Pitts, a veteran in the United States Air Force, who has recently been called to emergency active duty military orders indefinitely. My husband and I moved to Montgomery County, where we resided for over a decade, shortly before my graduating from Temple University. The past 18 months for my family have been rough. Shortly after my husband's return from an overseas deployment, he lost his civilian job of many years, and my business was impacted by the pandemic, causing us to live off of our savings. In an attempt to regain sustainability, we applied for the Emergency Rental Assistance Program, administered as the Emergency Rent and Utilities Coalition through Manor on Main Street / Montgomery County. We received approval for the ERUC program. Upon my explicitly confirming the parameters of my new home search, I was advised that there were no financial limits on the program and that I simply needed to find a landlord willing to work with the program. After 3 weeks of searching, living in hotels and Airbnbs, I did just that. At the point of lease signing on September 16, 2021, Manor on Main changed gears on the account of April McNeil of the Your Way Home program / Montgomery County. We were advised that the county is not able to authorize that amount and that auditors will want to see average or below average rent rate. I requested to speak with Ms. McNeil. When we spoke, she advised that she hadn't fully reviewed my case, but she wouldn't be able to justify allowing us to move into a home at that amount due to sustainability reasons. I inquired as to how sustainability beyond the program is determined when the whole premise of the program is for those who are unable to afford their rent and utilities currently. While she was pleasant, I was given numerous responses that were vague or lacked validity based on the county's own express guidelines. After asking what amount would she consider average, Ms. McNeil responded, "Whatever you think you'd be able to afford beyond the program," and then recommended a one-bedroom apartment for my family of 3. Only after the denial, Manor decided to assist with paying for our hotel. I was forced to choose and continue to pay for my own boarding, in which I followed the parameters given. Within 72 hours, the Montgomery County contact then advised that I must choose a hotel within the county's approved list. Per the plethora of reviews and personal experience, yes.
My apologies, your 2 minutes are up.
May I only have a little bit left, I promise.
At the discretion of the chair.
Thank you so much. Only after denial, Manor decided to assist with paying for our hotel. I was forced to choose and to pay for my own boarding, in which I followed the parameters given. Within 72 hours, the Montgomery County contact then advised that I must choose a hotel within the county's approved list. Per the plethora of reviews and personal experiences, the hotels recommended were very evidently unclean and unmanaged. So after my respectful pushback to not have to put my child and myself in unsanitary environments, they obliged. After the denial of the first home, I secured a realtor who attempted to gauge the parameters. We've now been advised to choose a 2-bedroom rental at fair market value. Because this amount is understood to be subjective, my realtor again has filed last week the Manor on Main asking for the dollar amount. No response has been received in about a week, putting us at a standstill. My son, dog, and I have spent weeks living out of hotels and Airbnbs with all of our belongings in a rental unit simply because Montgomery County is not making clear or constantly changing the parameters of the ERUC program. As expressed to my caseworker, while I am very grateful for this program and us being approved, this ambiguity and waywardness has added to an already difficult situation for my family. I come to you today, the commissioners of Montgomery County, asking for help in confirming what I can search for, help in getting my son and I a solidified place to live while we wait for the return of my husband, help in ensuring that though we're falling on hard times, a man, my husband, who's been called to tirelessly serve his country, can return to the comfort of a home and not a hotel. Help. Thank you.
Ma'am, thank you so much for coming, and I'm sorry that you've been through this. If you could make sure Ms. Washington over here has your contact information, okay? And we will follow up right away. And maybe Ms. O'Malley, do you want to just, yeah, okay. Well, this is Ms. O'Malley. She'll talk with you right now for a couple minutes, okay? All right. All right, any other public comment?
We do have one virtual public comment, but did anyone else have public comment in person?
No? Okay, all right, I just want to make sure we get to the in-person folks first. Okay, next up we have Sheila Dragon. You may unmute yourself.
Good morning, Commissioners. My name is Sheila Dragon, and I'm a licensed Pennsylvania Realtor. I am the Realtor that's been trying to help AJ Pitts find a place to live. I originally came to get to know AJ because she stopped at a property that I had listed for rent. We were, given the circumstances, willing to accept the Manna on Main Street project. We were ready to execute a lease, and then it came to both of our attentions that the rents and the property would not be allowed. I offered to become AJ's realtor to help her, and I have run into extreme frustration. I've pulled up lists of available places to live, 2-bedroom, 3-bedroom, took her out searching. And every time that we attempt to get something under contract or work with, a listing agent, things are very competitive right now. We have, 15 and 20 applications coming in on one property, and we are extremely frustrated with the lack of flexibility and them just giving us a monetary amount so we know how to search because of their circumstances, and 15 to 20 applications. It puts AJ and her husband at a disadvantage right out of the gate because not all tenants are willing to accept this type of program. So without the proper parameters and me being able to talk to the realtors ahead of time and sort of prep them and do my best to get them to see that this program is a worthwhile program, we're banging our heads against a wall, and we really need your help to discuss this with Manna and let me help AJ and Kayem find a place to live for them and their son.
Yeah, thank you, Ms. Dragon. I appreciate your bringing this to our attention, and you have my commitment that we will work to resolve this.
I appreciate that. Thank you.
You're welcome. Any other public comment?
No, not at this time.
Okay, great. All right. Thank you. We will move on to approval of the minutes. I will move to approve the September 23rd, 2021 minutes of the Montgomery County Board of Commissioners. Is there a second?
Second.
Second by Commissioner Lawrence. Any board comment? Hearing none, we'll move to a vote. Are there any negative votes? Hearing none, the minutes are approved. All right, Dr. Lorraine, it is flu vaccine season.
Just have 1 second to get your presentation up.
Yeah, well, while Kelly is pulling that up, I'd like to thank the commissioners for having us here this morning. Thank you all for being here. I'd also like to acknowledge the kind remarks from Dr. Arkoosh on the 30th anniversary of the Office of Public Health.
Dr. Lorraine, I'm going to have to ask you to talk to the mic, sorry.
So thank you very much for your kind comments regarding the Office of Public Health. I feel like a bit of a newcomer. I've only been with the department for some years. But I do really want to additionally acknowledge the other representatives of OPH who are here today. We have our outstanding public health nurses. We have Division Director Ruth Cole, Kaylin Roberts, and Mira Singer with us, who will be engaging in clinical activity shortly. So also thank you for the example that you're setting for our residents of Montgomery County. So this is our annual rite of passage, and it's kind of nice to get back to this in the midst of everything else that is going on. I'm going to talk a little bit about flu vaccination. What are the benefits of flu vaccination? Because obviously we're not going to do this unless there is a positive aspect of it. So, well, of course, number one, flu vaccination can keep you from getting sick with the flu. So there are millions of visits, office visits, that can be prevented by people being vaccinated and not catching the flu. You see some of the numbers up there. An estimated 7.5 million influenza illnesses can be prevented, which is an outstanding number. When we have a season where the vaccine is pretty much right on in terms of the serotypes, the risk of needing medical attention goes down by 40 to 60%, which is a very, very important thing. But the more important thing is that flu vaccination has been shown to decrease the severity of illness in people who get vaccinated but still get sick. So this is really, really key. And there is an analogy to what we're doing with COVID vaccination as well here. So it is really, really good when we vaccinate and we're able to see a decrease in the number of cases, but even better when we see a decrease in the severity of illness, the number of hospitalizations, and the number of deaths. And we have a wealth of data that shows that this is very, very significant. And while there may be years where the number of cases is decreased by 40 to 60%, the number of hospitalizations may be decreased by 85 to 90%. So when we have a decreased amount of hospitalizations due to severe flu, not only is everyone better off because clearly they're not as ill, but we decrease the burden on the healthcare system, which of course is something of major concern for us today. With the COVID pandemic, one of the main reasons that we do our mitigation strategies, why we've been so engaged in our vaccination program, is because we don't want to overtax our hospital capabilities in caring for the more severely ill individual. But you can reduce the risk of hospitalization by 80 to 90% by flu vaccination. So people who start off with certain health conditions, particularly the elderly, people who have COPD, diabetes, heart disease, things like that, this is vital for them in terms of preventing illness. These are the people who are particularly at risk for developing severe illness and death should they happen to catch the flu. And again, I can just substitute COVID-19 for flu, and it's really the same thing. Very, very important. So pregnant people, it's recommended by the American College of Obstetrics and Gynecology. It's recommended by individual obstetricians. This is a way to help preserve the health for women who are pregnant and are going to give birth during the flu season, the winter and the early spring. The flu vaccine is very, very safe, and it has been shown to confer protection to the baby as well for several months after birth. The child then is too young to be vaccinated. We only start vaccinating at 6 months. So if you get vaccinated, obviously you're going to protect yourself, but you're also going to protect the people around you, those who might be more susceptible to illness, those who might become sicker, who have chronic health conditions, the people in your family and your friends. Now, in spite of all this benefit, we still don't quite reach the levels that we like to in terms of flu vaccination. And that's why we have all of these programs to give information to the public so that people understand the benefits, the safety of the flu vaccines, and we also try to make it as available as possible. So you've seen this slide earlier today. Here's a graphic that indicates the flu clinics that we are having in Montgomery County. This year, because we already have our COVID vaccination sites set up, we are including flu vaccination at those sites. So that can be done at any time when these sites are open. If you go to the county website, you're able to make an appointment. You can get flu vaccine. For those of you who have not yet gotten your COVID vaccine, we strongly encourage that as well. Please be aware that you can receive both the COVID vaccine and the flu vaccine at the same time. In addition, we have multiple partners throughout the county, and one of our outstanding partners, representative here today, Beth Till, the Montgomery County Immunization Coalition, is having a Say Boo to the Flu clinic this weekend at the Elmwood Park Zoo. I believe the hours are 9 to 12. And if you go and you get your flu vaccine, that includes admission to the zoo. So hopefully we'll have nice weather and we'll have a great program. And I think that's all I have. Yes. So that's all I have in terms of comments, and then we are very, very pleased to be able to offer immunization to our county commissioners should they so desire.
Terrific. Well, thank you, Dr. Lorraine, and thank you to the team that's here today. And I just want to add one more thing, that it's so important with COVID still out there that we do everything we can to preserve our hospital resources, and that getting a flu shot helps reduce that chance of hospitalization. It's just one less pressure point on our hospitals, which are still dealing with over 100 people hospitalized in the county with COVID-19. So we hope everyone will do their part and help keep the whole community safe. All right, well, I'm ready.
Dr. Lorraine's not doing it, is he? So I'm not
I
sure. I know.
You know, I'd be happy to do it.
No.
So Mira Singer will be providing your vaccine today. She's been with the county for 29 years.
That's good. Good morning.
Good morning.
How are you? This one, yep.
Today. Did you all fill out the form?
I did. I cannot get it out.
I have Mr. Lawrence's also.
Yeah.
Before and no
Yeah.
problem,
Yeah.
right?
I think you've given me my flu shot before.
Okay.
I've been down this road before.
Thank you.
Yes.
That's good, right?
Gave it to Kelly. I filled it out, so.
That was easy. Thank you very much.
All right.
This one arm. We'll do this side. My hand is just to hold the other. Oh, I forgot to give you.
Oh, I get a button. Oh, that's awesome.
Let's not stretch this out.
Putting it on.
Barbara, are you smiling? Why are you smiling?
We just have to show you our gorgeous Band-Aids we're using. They're leopard print.
Thank you.
Yes, make it a little bit fun.
All right. Thank you all so much.
Thank you.
Really appreciate it. All right, folks. Well, it doesn't get any easier than that. So please get your flu shots. Thanks. All right. Next, we will move on to Domestic Violence Awareness Month. And we have our friends from the Montgomery County Women's Center here with us.
Good morning.
Hey, Maria. It's nice to see you again.
Thank you. Good morning, everyone. My name is Maria Macaluso, and I am the Executive Director of the Women's Center of Montgomery County. I want to thank you, Commissioners, for this opportunity to speak to you about our domestic violence program, the impact COVID-19 has had on access to services, and how our work has had to adapt to ensure that survivors and their families can achieve safety and stability. It is particularly meaningful for me to be here during Domestic Violence Awareness Month. It's a time when we not only honor survivors and pay tribute to the memories of lives lost, but we focus on engaging our community as active allies rather than passive bystanders in domestic violence prevention and intervention. I believe that while it's important to look at accomplishments, negative outcomes can also serve as a rich opportunity for learning. So I'm going to begin by sharing a little about the significant challenge survivors faced at the height of pandemic restrictions. But then I also want to talk about some of the really transformative and innovative changes made towards strengthening the resiliency of our programs. If nothing else, we need to come out of this pandemic with the knowledge and vision to respond to the needs of victims who were unable, either through fear, isolation, or lack of resources, to seek help. In fiscal year ending June 30th, the Women's Center served approximately 4,000 unduplicated adult victims of domestic violence. 88%, or 3,354 of those adult victims identified as female. 560, which is about 12%, identified as male. While that number may seem high, it was actually down from 5,000 victims served annually pre-pandemic. So what does that mean? We know that it doesn't mean that there was less family violence, particularly with 9 homicides in our county and an increase in 911 calls. Across our offices, the intensity, severity, and complexity of the cases presented challenges even for the most seasoned of our advocates. And in our hospital-based sites, we also saw an increase in the number of strangulation injuries, weapons-related injuries, particularly stabbings, attempted murder-suicide cases, and a level of physical brutality that we have not seen in years. Part of the reason for the decrease in numbers we know was due to 14 months of restricted access to the courthouse. Another reason for the decline, though, in the face of the pandemic, individuals experiencing non-physical abuse were less likely to report the abuse or reach out for services because there were limited options and resources to assist them, such as therapeutic counseling, drug and alcohol services, and access to behavioral health services. That is really the darkest aspect of the past year for us, to know that victims of domestic violence were further victimized by an inability to escape and to make contact because of the pandemic. Technology helps, but we need to do more to ensure that no one is ever trapped in their home with their worst nightmare and unable to get help. Sadly, I can tell you, however, that our experience in Montgomery County exactly mirrors the experience of domestic violence across the state. In 2020-2021, there was a 20% decrease in the number of victims served across our state, down from 100,000 in the prior year to approximately 80,000 this past year, for much the same reasons. With the reopening of the courthouse to our advocates in June 2021 and the gradual restoration of in-person services, we have seen the numbers return to pre-pandemic levels. I am hopeful that this means our systems are finally connecting with those who delayed reaching out for help because they viewed staying with their abuser as the lesser of the evils they faced during a public health crisis. So that is a really troubling aspect of the past year, knowing that domestic violence victims were at times triaged, either by our systems or by self-imposed determination that their issues didn't rise to the level of a crisis during a pandemic. As a domestic violence provider, the Women's Center is committed to increasing outreach to remind the public that abuse of any kind, physical, emotional, mental, financial, should not be tolerated. Okay, now for the really bright highlights of the past year. I'm incredibly excited by the creative, collaborative, and innovative efforts of our staff and volunteers to evolve and adapt during the pandemic. Some examples include our work with our healthcare partners, in particular Jefferson Abington Health. That name doesn't roll off the tongue since they keep changing it, where our medical advocates stayed on site throughout the pandemic, working with victims who co-presented with COVID-19 and coordinating services across our organization to ensure that patients received medical treatment, legal assistance, and other resources needed. An example of the coordination of our services can be found in the patient who came into the hospital's emergency trauma unit after her abuser brutally attacked her, attempted to strangle her, and then threw her out of the car and left on the road. The patient was admitted for head trauma. She required a fairly long admission. During that time, our legal advocates were able to obtain a bedside PFA from the hospital, get her reconnected with estranged family members, provide clothing and toiletries that were donated to our thrift shop, provide a cell phone, and fund a hotel room for several nights following her discharge until family could come from out of town and bring her home with them, where she's now safe. This example demonstrates a synergy of the services we offer. All of this was done while observing COVID-19 precautions. And it was accomplished because we were able to increase emergency resources, increase staffing, and develop alternative strategies when in-person access to our courthouse was not an option. And a lot of that came through our county and through people within our county who supported the work. So thank you for that. We have also strengthened our partnerships with our police departments. With opportunities for in-person training limited, we developed and distributed training packets, including a video on USB drives and printed resource materials for law enforcement, magisterial district justices, and healthcare providers to continue to build on their effective response protocols for victims of domestic violence. These were distributed to 52 police departments, 30 magisterial district justices, and over 750 healthcare workers in the past 9 months. Out of this outreach, we have developed strong connections with police officers that created a coordinated cross-disciplinary response to domestic violence. We have officers regularly calling us now to assist victims with services such as counseling, transportation, emergency hoteling, security systems, food, lock replacements, and other immediate needs. There's been a trust and reliance established between our programs and the police that did not exist to this extent pre-pandemic. By transitioning some of our programs to virtual platforms, we've been able to increase service opportunities. This includes an increase in the number of support groups we offer. These virtual opportunities appear to address pre-pandemic impediments such as lack of childcare, transportation, and safety by moving it to a virtual format. We created a virtual financial empowerment curriculum specifically developed for DVA survivors. This month, we are expanding that project to provide one-on-one coaching to members of our support group. With the pandemic limiting our ability to provide in-person presentation, we developed age-appropriate virtual educational models, which we shared with more than 4,000 students in our school districts. In October 2020, we launched a teen safe dating text line so that teens in potential crisis can easily access confidential help. In February 2021, we launched a dedicated website, safedatingforteens.org, as an additional resource. We transitioned our mandatory volunteer training to a virtual curriculum and successfully engaged and trained 67 new volunteers to provide direct service on our hotline. With legal aid, we developed self-help videos and PowerPoint presentations on divorce, child custody, and support that are posted on our website. And as a side, I want to say that the county's website, we've received more than 2,400 people viewing our videos, so thank you again for that. Finally, I want to talk about our work with underserved populations. We've remained strongly committed to our established partnerships that address the needs of elder abuse victims. Through our partnership with Jefferson Abington, we were able to provide in-person direct services to elderly victims within the healthcare system, particularly throughout the pandemic. Latina victims. Throughout the pandemic closures, our bilingual advocate provided translation services, counseling, and legal advocacy to Spanish-speaking victims and their family. Our translation services were regularly requested on an ongoing basis by the courts and law enforcement. And our work with LGBTQ plus victims. We partnered with the Sexual and Gender Acceptance Community, SAGA, and we co-facilitated a weekly support group for LGBTQ plus members who, in addition to experiencing intimate partner violence, were experiencing COVID-related isolation and anxiety issues. We participated in the planning of Montgomery County's first Pride event, which was held in July in Abington, and served on Congresswoman Madeline Dean's LGBTQ roundtable. In February, we partnered with the Deaf, Hearing Communication Center to explore programming and procedures to improve access to services for this underserved population. I want to close by saying that the Women's Center has been extremely fortunate to be a part of a number of local collaborative efforts and cohorts created to promote diversity, equity, and inclusivity, such as the Bucksbaum Collaborative, the Safety Net Resiliency Initiative, and other social justice initiatives that are thriving in our community right now. We realize with great pride and gratitude that as our Montgomery County leadership, you have been visionary in demonstrating a commitment to addressing the challenges of oppression and inequity and creating opportunities for change. So on behalf of the Women's Center of Montgomery County, I want to thank you for that opportunity and for making a difference. Thank you.
Maria, thank you so much. That is an incredible report and just extraordinary work that you and your team are doing just to pivot and keep at the work. Did you say 67 new volunteers? Is that right?
Yeah, we were surprised we could do it, but we trained 67 people and now they are well trained and on our hotline, and we provided another 11 90-minute sessions to skill building for existing volunteers. So our volunteer corps remains strong and committed thanks to our residents here.
That is so impressive. And, you know, we talked about this at many press briefings, particularly in the early days of COVID, just to reinforce the need for people to continue to reach out who need help, and that there were still ways to do that, and that organizations like the Women's Center were pivoting to do things online. And we just really appreciate all of that work. Obviously, the need did not go away. I agree with you. I'm sure there was some underreporting last year for understandable reasons, and we're just grateful for the work that you do in your community. No one should ever go home and not feel safe in their own home. And
if I can just add one thing, I do want to tell you, yesterday I was in a state meeting of 62 programs, and they were all talking about how their communities were not receptive to stepping up especially with the DEI issues. And I was very proud to say that I must live in an extraordinarily wonderful community because our commissioners are great. So thank you for that.
You know our commitment is strong, for sure. So congratulations. We will be, if we haven't already, be lighting the courthouse purple this month for domestic violence awareness. And we look forward to continuing to highlight and lift up all month these really critical issues.
Maria, it's great to see you. Thank you for the very comprehensive report. The Women's Center is truly a wonderful partner for the county and resource for those in our community. So we want to thank you for all the work you do, not just this month, but every month, every day, every week during the year, and during the pandemic as well.
Thanks so much.
Maria, I'd also like to thank you and your team for everything you do to protect and provide aid to victims of domestic abuse, as well as prevent domestic abuse here in Montgomery County. So keep up the great work, and we're very proud of you.
You guys too. Thank you.
All right, take care. Thanks for coming today. All right, IDA recovery efforts. Kelly, I'll turn over to you for who is going first.
We are going to start with Kaylee Silver.
Good morning, Ms. Silver.
Good morning, commissioners and county staff. I'm Kaylee Silver, the Administrator for Housing and Community Development with the Health and Human Services Department. So as you know, and has previously been discussed, Hurricane Ida has caused vast damage in our county. Emergency response is still ongoing, and the recovery will be long. But our community is strong and resilient, and I'm proud to be here to report out on the details of how county leadership, partners, local communities, nonprofits, and our neighbors have all really stepped up and supported in some amazing ways. We're now more than 30 days out from the FEMA disaster declaration of Hurricane Ida's devastation. In that time, we have set up emergency response for households displaced by the hurricane, whose homes have been majorly damaged, condemned, or destroyed due to the disaster. We have partnered with 211 and 24 different hotels throughout Montgomery County in order to provide emergency hoteling for these households. Currently, as of today, we have 169 households comprised of 374 people in hotel rooms funded by the county. Any other household still in need of emergency lodging due to Hurricane Ida can call 211 or text their zip code to 898-211 for help, and that can be 24 hours a day, 7 days a week. Additionally, we have partnered with Upper Marion Food Cupboard, the YWCA, SHARE, Montgomery County Anti-Hunger Network, or MON, and Catholic Social Services, who have already provided hundreds of meals to households in these hotels so far. Emergency financial assistance has also been provided to households in these hotels to cover emergency basic needs. And additionally, as previously mentioned by Commissioner Arkoosh, an ongoing emergency fund has been set up at Montgomery County Foundation to continue to support the needs of these households. We're assisting with transportation, clothing, medicine, technology, and assistance to return to permanent housing. These households have lost everything, all of their possessions and the stability of their homes. And we recognize that the devastation of Hurricane Ida has been great and that there are still people in Montgomery County with needs. We'll continue to work in response and recovery to assist our neighbors affected by the disaster. We're committed for the long journey ahead. And I need to thank and recognize the efforts and commitment of Montgomery County Health and Human Service leadership, county leadership, our local hotel administrators, Yvonne, Stacy, Carlton, Regina, our coordinator, Nancy Walsh, our partnered hotels, but especially and particularly the local nonprofits and community members who have worked tirelessly since day one to be boots on the ground and assist these households directly. Intentionally, I want to thank ACLAMO, Montgomery County OIC, our Montgomery County Family Centers, the aforementioned food partners, such as Upper Marion Food Cupboard. And I have to give a special thank you to Barbara O'Malley, who's been a leader and inspiration in this effort. She's worked tirelessly, and she also keeps reminding us, rightfully though, that however hard this may be for the response and recovery team, whom have all done amazing things, it's harder for the households who have lost everything due to Hurricane Ida. So we keep that in our minds and our hearts, and I hope that the community knows that we will continue to work to support, fill these unmet needs, and be with them throughout this recovery, and we'll get there. So with that, for more particulars, I'm going to pass it along to Jason Wilson, Deputy Director of Emergency Management.
Jason, you're muted.
Sorry, you think I'd be used to that by now. Sorry about that. My name is Jason Wilson, Deputy Director of Emergency Management. I'm going to attempt to share my screen here for a really brief PowerPoint. Can everybody see that?
Yep, you were
Okay.
successful.
So just looking at a brief event summary, some points about individual assistance, public assistance, debris management, and mitigation efforts that we have ongoing in the county. So remnants of Hurricane Ida hit Montgomery County in the afternoon of September 1st. Throughout the 1st and 2nd, the counties received in certain areas up to 7 to 10 inches of rain. With that brought major flooding and record flooding in Norristown, Upper Providence, Bridgeport, and municipalities along the Perkiomen Creek. That flooding caused 467 water rescues, 9,034 incoming 911 calls, and for a 1 hour point from 6 p.m. to 7 p.m. on the 1st, a peak of 1,067 calls. During that time, we also had an EF2 tornado touchdown with 130-mile peak winds with a path length of about 8 miles from Fort Washington into Horsham. With that, there were 3 fatalities in the county. From the damage, we learned very quickly from reports from municipalities and public reporting through our public reporting form that we were going to need some form of assistance from the federal government and from the state government to assist residents. As such, we conducted a preliminary damage assessment for individual assistance on the 7th of September. In that, we found 46 destroyed homes, 269 major homes, 91 minor homes, and 41 affected, for a total of 447 homes. That number seems somewhat low compared to the reports that we received. And these are the homes that FEMA and PEMA went out to look at in the days after the storms. Because of the level of damage, we opened a multi-agency resource center, which was geared to get assistance quickly to the residents that were affected by this event. That was quickly followed by a disaster recovery center on September 17th after the Commonwealth and county received the individual assistance declaration through the federal government. And as of October 7th, there were 298 people have visited this recovery center. Public assistance, shortly following and in concurrence with the individual assistance, we started receiving reports about damage to infrastructure throughout the county. That sparked a preliminary damage assessment for public assistance, where we reviewed with FEMA and PEMA personnel damages throughout the county. With that, we found an uninsured loss of almost $6.7 million, which put us well above the $3.1 million threshold to seek public assistance declaration through the Commonwealth. We are still waiting to hear back from FEMA for our declaration for the Commonwealth. The damage included damage to critical infrastructure, bridges, water, sewer treatment plants, and municipal owned properties and roads. In addition to the damage, we have everything that comes after the damage. So the debris associated with the flooding and the tornado damage. Because of that, the Department of Public Safety activated our standby contract with Disaster Recovery DRC and Debris Tech on September 5th. And this contract is designed to locate the debris, pick up the debris, and properly dispose of it, all with the intent with getting proper reimbursement through FEMA and the federal government. The debris management site is located in Upper Dublin Township, and to date, almost over 170,000 cubic yards of storm-related debris has been removed from municipalities throughout the county. And that includes construction debris, vegetative debris, and appliances that normally wouldn't be able to be picked up by household waste contractors. And we are currently coordinating this effort with municipalities throughout the county. Mitigation update. So along with the recovery comes the look at mitigation. We are forming a planning team with various county departments to assist with this mitigation. The goal is to identify all the flood damage locations, increase mitigation efforts to decrease future loss, and coordinate with county and local stakeholders in the mitigation efforts. Most importantly, we'll be looking to identify grant funding for future mitigation projects throughout the county to assist those who've been affected by this flooding. And then we hope to incorporate all these findings with the county hazard mitigation plan in hopes that the affected areas are eligible for some type of funding. And I too would like to thank our partners at HHS and Barb O'Malley for all the support and assistance we've received through this event. Thank you.
Thank you, Jason. All right. Director Miller, I think you're next.
Good morning.
Good morning.
Good, you can see me. I'm Dennis Miller. I'm the Administrator of Veteran Affairs, but I'm speaking to you today as a member of the Department of Health and Human Services. After the storm, we kind of banded together, and we still do so. That's the best thing about HHS is we can adapt as needed. I want to give everyone something that they can take home with them right now in my comments. We suffered an incredible amount of damage. You heard all about it. From Hurricane Ida, the flooding, and a Force 2 tornado. Let me repeat that, a Force 2 tornado that ripped a swath of damage for 8 miles. Having lived in the Midwest, that's big, even for like Kansas and Oklahoma. That's a big deal. And so many people have lost everything. People died. They were physically wounded. They were wounded here. I'm going to talk about that in a minute. Over 400 water rescues from our first responders almost immediately. Homeowners had their homes washed away or condemned. Renters returned to their homes to find everything ruined or even worse, completely cleaned out and discarded by landlords without any kind of notice. The summary that we gave today, it sounds like it's over, but it's not over. It's great. County departments, boroughs, townships, private individuals, nonprofits are still leading the charge as responders and providing leadership that we all need. Many of the affected are still in hotels, but a lot of people are still holding up in houses without electricity or water or living in overcrowded conditions, and we're worried about them. We ask them to seek assistance. We're here for you. We've always been here for you. If you're hoteled and you have problems, we ask that you speak to your HHS hotel ambassador. If you're not hoteled and maybe you're thinking about it, reach out to the Office of Community Connections for that and other needs, and they'll point you in the right direction. And take the assessment that Dr. Arkoosh talked about, the HERE assessment. We need to know what issues you have so we could throw case managers at you to try to help you with your problems. We could dispose of the debris. I mean, I saw a mountain. I never thought I'd see this in my life in Port Providence, Montclair, a mountain of refrigerators and washers and dryers and appliances in a parking lot. We could dispose of the debris, we could find new places to live, and we could buy more stuff. But the trauma of the storm has cut through all of us. And now that the flood waters have receded, literally and figuratively, I ask you to take care of yourself and take care of your mental health. Call your doctor or medical provider. Call the mobile crisis team, 855-634-4673. Call the suicide prevention hotline or the Veterans Crisis Line if you are able. 1-800-273-8255. Just talk to somebody, tell your incredible story, and get some help because you deserve it. Thank you.
Thank you, Mr. Miller. I appreciate your words. And just thank you to all of you. I think this is an important reminder that the aftermath of Ida is far from over for so many families and communities and businesses here in the county. And we just want everyone to know that we are still here with you and that we are going full steam ahead to try to get things back to normal as quickly as possible, knowing that it is certainly going to take some time for many homes and businesses to get fully back on their feet. And that we remain committed to taking steps to combat climate change in our region. Our county's been at the forefront of this work, and we will continue to do that work. And I think storms like Ida just remind us how imperative it is that we are successful. So thank you all so much, and we'll keep checking in with you to make sure that everybody has what they need as we go forward, and thank you everyone for your hard work. I also want to just acknowledge Ms. O'Malley, who has really worked incredibly hard to make sure that the folks that need housing are housed, and that at the hotels in particular, that people have the food and the clothing and the transportation and the other things that they need. So thank you so much.
I want to thank the response and recovery team, those who presented today, and everyone who's been working on this. I think this is very important for our community to see and know that this event is not over. The hurricane came, but we're still dealing with the aftermath of that. We have neighbors who are struggling. We have neighbors who have been displaced. And I think for many, they've moved on. It's not raining anymore. There's no more water, but people are still dealing with this. So I want to thank the team. I also want to acknowledge Ms. O'Malley, our Deputy COO, who I know has been working around the clock on that and keeping us informed and visiting the hotels and leading the team. But if I can just say once again to anyone watching, we have neighbors out there who need help now.
I too would like to thank all the county staff for working tirelessly over the last several weeks to help recover the damages that Hurricane Ida struck here in Montgomery County, and also all our partners, the municipalities, the local governments, and especially our first responders who have been working tirelessly as well. So thank you, and hopefully we get back to a sense of normalcy sometime soon for these families.
Okay, we will move on to resolutions. Mr. Steinen, authorization to transfer additional funds to the Redevelopment Authority for the Montco Strong Nonprofit Grant Program.
Yes, thank you. And I'll start off by noting that while this would normally be presented by our Director of Commerce, David Zellers, he is currently on a panel at the Pennsylvania Economic Development Association's Fall 2021 Conference, which is being hosted here in Montgomery County this year. So, but in the meantime, I'm happy to present this. This relates to the Montco Strong 2021 Nonprofit Resiliency Grant Program, which is administered by our Redevelopment Authority. Earlier this year, the commissioners funded that program to the tune of $5 million to assist nonprofits which have been negatively impacted by the COVID-19 global pandemic. This resolution is a request for an additional funds in the amount of $2,558,300. With that additional funding, that will allow the funding of 226 grants, which we have been applied for. Without that additional funding, only 131 grants of those reviewed and approved by the review committee would be funded. And if approved, the county's total amounts of funding would rise to $42 million in grants to nonprofits and small businesses since the beginning of the pandemic.
All right, thank you. I will move that the proper county officials, in accordance with the authority conferred by law, subject to the approval of the county solicitor, are hereby authorized to transfer up to $2,558,300 to the Montgomery County Redevelopment Authority to fund the Montco Strong 2021 Nonprofit Resiliency Grant Program. Is there a second?
Second.
Second by Commissioner Lawrence. Mr. Stein, could you just clarify for those listening where this money is coming from?
These are funds that we received from the federal government as part of the Recovery Act.
Great, thank you. Any other board comments? All right, hearing none, we'll move to a vote. Are there any negative votes? Hearing none, motion carries. Thank you. All right, Ms. Perdue. Good morning.
Good morning, Commissioners. You should have in front of you the final copy of the Commissioners' Department's personnel list. It is a 3-page document dated Tuesday, October 5th, 2021, with a timestamp of 12:05 p.m. All positions have been reviewed and accounted for and are presented for consideration.
Thank you. I will move to approve the October 7th, 2021 personnel presentation as given by the Director of Human Resources, Ms. Donna Pardue, and to authorize the proper county officials to execute the same. Is there a second?
Second.
Second by Commissioner Lawrence. Any board comment? Hearing none, we'll move to a vote. Are there any negative votes? Hearing none, motion carries. All right, Ms. O'Malley, advertisements of bids and RFPs.
Yes, one, we have a bid on behalf of Assets and Infrastructure for equipment rentals. The successful responders will provide equipment and/or rental services on an as-needed basis for roads, bridges, parks, and trails. Contracts will be awarded to the lowest responsible bidders. Two, a bid on behalf of Assets and Infrastructure for masonry services. The successful responder will provide multi-stage masonry repair services for Sunrise Mill and Schwanksville. Contract will be awarded to the lowest responsible bidder. Three, an RFP on behalf of Health and Human Services for a training program. The successful responders will provide prevention and early intervention school-based services to enhance the mental wellness of Montgomery County K through 12 students. Contracts be awarded to the highest rated responders. 4, RFP on behalf of Health and Human Services for a prevention program consultant. The successful responder will develop and initiate a public health program to support student mental health and substance misuse prevention for Montgomery County colleges and universities. Contract will be awarded to the highest rated responder. 5, an RFP on behalf of Health and Human Services for an education program consultant. The successful responder will assist the Office of Drug and Alcohol with implementing parent education programming to targeted populations of African American and Latino families in Montgomery County. Contract will be awarded to the highest rated responder. All bids and RFPs are available on the county's purchasing website at www.montcopa.org/purchasing.
Thank you. I will move to approve the preceding request for the advertisement of bids and RFPs as described by the Deputy Chief Operating Officer, Ms. Barbara O'Malley, and to authorize the proper county officials to execute the same, subject to the approval of the county solicitor. Is there a second?
Second.
Second by Commissioner Lawrence. Any board comment? Hearing none, we'll move to a vote. Are there any negative votes? Hearing none, motion carries. Next, we have awards of contract.
1, a contract award, voter services, equipment support. Blue Crest Incorporated of Danbury, Connecticut, $40,483.12. Contract provides on-call ballot processing equipment support for a 1-year period. Support services are available from a Sourcewell cooperative contract. 2, contract award assets and infrastructure vehicle. Del Valle International of Montgomeryville, PA, $125,000. Contract provides a 2020 International dump truck for use by roads and bridges. Vehicle is available through a PA CoStarz contract. 3, contract award assets and infrastructure equipment. John Deere Governmental Sales of Moline, Illinois, $270,806.16. Contract provides the lease of 3 loader units for use by roads and bridges. Equipment lease is available through a PA state contract. Leases are for a period of 3 years. 4, contract award assets and infrastructure equipment installation. Mortec Manufacturing of Azusa, California, $679,856. Contract provides general construction services for the furnishing and installation of specialty equipment for construction of a new coroner facility. Specification 6457 was viewed by 32 firms with 1 submission. Contract is awarded to the only responding bidder who has met all qualifications of the specification. 5, contract award, human resources, staffing services, multiple providers. Contract provides for temporary employment agencies to provide personnel services on an as-needed basis. RFP 2123 was viewed by 92 providers with 21 responses received. Contracts are awarded to all responding providers. Rates vary based on position skill levels. Skill levels include administrative, medical, and election clerk services. List of responding providers are listed at the end of the agenda and the back of the room. Contract term is 1 year with 4 annual extensions. 6, contract award, public safety, furniture. Tanner of Pennsylvania of Harrisburg, Pennsylvania, $21,630.26. Contract provides replacement workstations for the Emergency Operating Center Radio Technician Office. Furniture is available through a PA CoStarz contract. 7, contract award, public safety, Comcast Cable of Southeastern PA, $44,400. Contract provides cable and internet services for the Public Safety Emergency Operating Center. Contract is for a 1-year period. 8, contract award, public safety, support services, CDW Government of Chicago, Illinois, $23,322. Contract provides a core switch service and support agreement for the 911 system. Services are available through a PA CoStarz contract. 9, contract award, security. Security Services, Integrated Security Systems, LLC of Harleysville, PA, $30,945. Contract provides the access control and security hardware for 7 doors at the Pottstown Annex. Equipment and services are available through a PA CoStarz contract. 10, contract renewal, assets and infrastructure, contracted services. United Site Services of Westboro, Massachusetts, $32,000. Contract provides portable toilet rentals for various Montgomery County parks and historic sites within the county. This is the second and final optional annual renewal term. 11, contract amendment, Information Technology Solutions equipment. Rico USA of Wayne, PA, $175,000. Original contract provided for the purchase of color production printer for use at the county print shop. Amendment provides maintenance and support for a 60-month term. 12, contract amendment, Information Technology Solutions equipment. Rico USA Incorporated of Philadelphia, PA, $40,000. Original contract provided for the purchase of a Rico black and white copier for use at the county print shop. Amendment provides maintenance and support for a 60-month term. 13, 2 contracts, 5 contract renewals, and 7 amendments for Health and Human Services. Providers and services are listed at the end of the agenda and the back of the room.
Thank you, Ms. O'Malley. All right, first we're going to vote on item number 1. I will move to approve the preceding award of contract for item number 1 for voter services, as described by the Deputy Chief Operating Officer, Ms. Barbara O'Malley, and to authorize the proper county officials to execute the same, subject to the approval of the county solicitor. Is there a second?
Second.
Sorry about that. All right, any board comment? All right, hearing now, we'll move to a roll call vote. Ms. Washington?
Chair Arkoosh.
Aye.
Vice Chair Lawrence.
Aye.
Commissioner Gale.
Opposed.
All right, motion carries. Next, I will move to approve the preceding awards of contract items number 2 through 13, as described by the Deputy Chief Operating Officer, Ms. Barbara O'Malley, and to authorize the proper county officials to execute the same, subject to the approval of the county solicitor. Is there a second?
Second.
Second by Commissioner Lawrence. Any board comment? Hearing none, we'll move to a vote. Are there any negative votes? Hearing none, motion carries. All right, awards of contract for emergency procurement for Hurricane Ida.
Yes. 1, vehicles for assets and infrastructure, Whitmore Ford of Mountjoy, PA, $130,200. Contract provides for 3 F-350 trucks with plows. Trucks are available through a PA CoStarz contract. 2, equipment, assets and infrastructure, Deere & Company of Cary, North Carolina, $126,629.90. Contract provides for replacement of 3 John Deere commercial mowers and 5 John Deere Gators for Lower Perkiomen Valley Park. Equipment is available through a PA state contract. 3, equipment, Health and Human Services, Deere & Company of Cary, North Carolina, $14,754.30. Contract provides for John Deere Gator to replace the unrepairable ATV used by the Office of Public Health. Equipment is available through a PA state contract. 4, services, Health and Human Services, Your Way Home Fund, Montgomery County Foundation Incorporated of Bluebell, PA, $25,000. Contract provides for gap rental assistance as needed for displaced residents of Hurricane Ida. 5, services, Health and Human Services, Montco Anti-Hunger Network of Bangor, PA, $1 million. Contract provides funds for food distribution to various Montgomery County food pantries to provide food for residents affected by Hurricane Ida. 6, contract amendment, assets and infrastructure, equipment. Plago Company, LLC of James Creek, PA, $8,550. Original contract provided for replacement of storm-damaged playground equipment at Lower Perkiomen Valley Park. Amendment provides for installation of new playground equipment. Lower Perkiomen Valley Park staff are no longer able to accomplish installation as a result of lost park resources due to Hurricane Ida.
All right, thank you. I will move to approve the preceding awards of contract as described by the Deputy Chief Operating Officer, Ms. Barbara O'Malley, and to authorize the proper county officials to execute the same, subject to the approval of the county solicitor. Is there a second?
Second.
Second by Commissioner Lawrence. Ms. O'Malley, just for clarification, items 1, 2, and 3, those are all pieces of equipment that were destroyed in the flooding or other, okay.
Yes,
So we are
that's correct.
this was existing county equipment that we are
Yes.
now replacing?
Yes.
Due to
All those
damage,
items.
okay. Any other board comments? All right. Hearing none, we will move to a vote. Are there any negative votes? Hearing none, motion carries. Next, we have a award of contract for the Southeast Pennsylvania Regional Task Force.
1, contract award, equipment, Glick Fire Equipment of Birmingham, PA, $139,220.04. Contract provides for 4 tethered unmanned aircraft systems for use by the Montgomery County Public Safety Department. Equipment is proprietary and is the only tethered unit that meets the requirements of the National Defense Authorization Act. 2, contract renewal, equipment maintenance, Celex ES Incorporated, LSEG ALPR, ANPR Solutions of Greensboro, North Carolina, $35,000. Contract provides for maintenance and repairs of all automatic license plate reader units for the regional counties. Contract is for a period of 1 year, and the equipment is proprietary to the vendor.
All right, I will move to approve the preceding awards of contract on behalf of the Southeast Pennsylvania Regional Task Force as described by the Deputy Chief Operating Officer, Ms. Barbara O'Malley, and to authorize the proper county officials to execute the same, subject to the approval of the county solicitor. Is there a second?
Second.
Second by Commissioner Lawrence. Any board comment? Hearing none, we'll move to a vote. Any negative votes? Hearing none, motion carries. Thank you, Ms. O'Malley. Any closing commissioner comments? All right, then I will announce that we will follow immediately with an election board meeting. and that the next Board of Commissioners meeting is October 21st, 2021. And I will move to adjourn the October 7th, 2021 meeting of the Montgomery County Board of Commissioners. Is there a second?
Second.
Second by Commissioner Lawrence. Any board comment? Hearing none, we'll move to a vote. Any negative votes? Hearing none, meeting is adjourned. And we will begin salary board. And Controller Sanchez, I understand, is online?
Good morning. Can you hear me?
Yes, we can hear you. Thank you.
Good morning, members of the Salary Board. You should have in front of you the final copy of the Salary Board list. It is a 3-page document dated Tuesday,
Ms.
October...
Purdue, I'm so sorry. I forgot to ask for public comment on salary board. I apologize.
That's okay.
Okay, if there's anyone who would like to give public comment on salary board, please indicate by raising your hand.
Okay. Do not have any public comment. Sorry.
Okay. All right, Ms. Purdue, once again, from the top.
Good morning, members of Salary Board. You should have in front of you the final copy of the Salary Board list. It is a 3-page document dated Tuesday, October 5th, 2021, with a timestamp of 12:05 p.m. Of note, we have 3 retirees: Chad Griffo from Assets and Infrastructure after 35 years, Anna Zepidoro from the Controller's Office after 33 years, and Susan Losella from Courts after 33 years. All positions have been reviewed and accounted for and are presented for Salary Board consideration.
Thank you. Is there a motion to approve the October 7th, 2021 Salary Board presentation as given by Director of Human Resources, Ms. Donna Pardue, and to authorize the proper county officials to execute the same?
So moved.
Moved by Controller Sanchez. Second by Commissioner Lawrence. Any board comment? All right, hearing none, we'll move to a vote. Are there any negative votes? Hearing none, motion carries. And I understand we have some acknowledgements of some of these long-term employees.
Yes, we do. We could start with Steve Patinsky.
Good morning, Steve.
Good morning. For those who don't know me, I'm Steve Patinsky, the Retirement Manager for Montgomery County, and I'm here today to speak on behalf of Anna, who's retiring from the Retirement Department. As you can see, she's not here today, but anybody who knows Anna knows that she doesn't go in for recognition and awards and things like that. She's all about service and helping people, and she's done that for her whole entire career with the county. I've had the pleasure of working with her for the past 10 years, and it's been a pleasure and it's been an honor to work with her because she's such a professional. I came into the department not knowing anything. She was there for me every day. If I needed anything, she knew where it was. She knows where everything is. And she's just been a big asset to the county, and it's going to be hard to fill her shoes when she leaves. I had the ability to see her in action. I sit very closely to her. I can hear her conversations from time to time. People would call in, and she would know them. She would be able to say, "How's your husband? How's your wife? How are your kids doing?" And she genuinely knows who they are. It's not like she's just saying that to say that you would. She would know these people, and she knows their stories. And when employees came, it's the same thing. She could talk to them on a one-to-one level and just really relate to what they're going through, because retirement's a scary situation, and she could do that for them. And she's just been a very valued employee, and we're going to miss her very much. And I just wanted to make sure that she got her due, because she's put so much time and effort into making the retirement department a very positive experience, positive place to be. We try to do the best we can to react to everybody's needs, and she's a big part of doing that. She's the voice you hear on the phone most of the time. And on the rare occasions I have to take a phone call, or Debbie, and someone will finish up with our phone call, and they'll always say, "Is Anna still there?" And we'll say, "Yes, she's still here." She says, "Oh, that's good to know," because they know her, they call her, they know they can reach out to our department, and Anna's going to be there. I come in, as early as I come in, she's there ahead of me. She's already got everything running and going, and everything is always set up. So I just want to thank her publicly for all her years of support with me and for the county. And it's going to be hard to replace her, but we'll do the best we can. So thank you very much for your time.
Very, very kind words.
Thank you.
All right, who is next?
Can I just add to that?
Oh, yes, of course, Controller.
I'm sorry. Thank you, Steve, for those words. I agree that Anna is going to be a big loss to our department. And I just wish her very well and a very long and happy retirement. Thank you.
Thank you.
And next we have Magna Deneen.
Good morning.
Good morning. I'm Magda Deneen, the Chief Court Reporter of the Official Court Reporters of Montgomery County. It is my pleasure to stand before you to acknowledge the coming retirement of Susan Lasella, my colleague and friend. Sue is a lifelong resident of Montgomery County. Her service to Montgomery County extends beyond the 33-plus years reflected on the paperwork before you. Sue was part of a team who were assigned to report district justice hearings and depositions for the courts of Montgomery County on a freelance basis. She joined that team in 1980. Her total service to the county is really 41 years. As an official court reporter, she has reported and transcribed verbatim testimony in matters handled by all divisions of the court. In doing so, she has engaged her body and mind to perform her tasks. The body, she is a highly skilled and talented writer using her stenographic machine. The mind, during her career, she acquired an encyclopedic knowledge in law and expert testimony that can range from fingerprint analysis in a homicide trial to a neurosurgeon's diagnosis, treatment, and follow-up care of a malignant brain tumor in a civil trial, thus producing a precise transcription of the testimony. I recall quite clearly that Bernie Gallagher, chief court reporter, way back in the early 80s, remarked that of the new crop of us reporters, Sue Lasella was the most gifted. She has served 50-plus judges. Most notably, she was the personal reporter of the late President Judge William W. Vogel. She's enjoyed the camaraderie of hundreds of attorneys. She's encountered thousands of litigants. All have relied on her integrity and diligence in preserving the record of a citizen's rights in the judicial forum. Sue has served the public with superlative competence and professionalism. Thank you, Sue, for sharing your career with us.
Thank you. That was lovely.
All right. And then finally, we have Tom Bonner.
Mr. Bonner, good morning.
Morning, everyone. Chad Griffo walked into a county mailroom in 1986 with what was affectionately referred to as a lumberjack beard that covered a large portion of his shirt, probably not knowing he would walk out 35 years later an institution unto himself. At the time, the mailroom was apparently, I wasn't there, no more than a small office room at the end of a, quote, long, dark courthouse basement hallway, and Chad was a part of a sparse team that distributed the mail. He was and remained jovial for all of his 4 decades with the county, committed, a quick learner, and a patient trainer. He built lifelong friendships to the level that his colleagues speak platitudes of his skill as a father, and fondly of the son who grew up through the stories that Chad related his work. For much of Chad's tenure, his father worked at the Norristown Post Office. And so, his daily collections with his coworkers were frequently marked by insider conversations that inured to collective efficiencies with, professionally brief, of course, family business sprinkled in. He was infallibly reliable and flexible and leaned forward to meet whatever need arose. He was the emblematic staff person for the office in an operation that moves constantly in the background and is most successful if it's none of its beneficiaries even know it exists. Chad was integral to its engine. The mail gets delivered and collected and processed every day, and every day for 35 years, Chad Griffo learned the process, changed the process, trained the newcomers, adapted to droughts and deluges, and was every day, quote, the best type of guy you could ask for, end quote, in the room or in the van or in the elevator. Chad would bristle at any loftier descriptor, so I'll use something I think he'd at least not shake his head at. In a department full of them, and like so many of the colleagues across the county offices, like those two mentioned today, he has truly been an unsung role model. The beard got shorter and his hair got whiter, and he leaves the county an institution, having helped keep the institution humming along. He will be missed by our team, but we wish him and his family the best in retirement and will keep him in our thoughts. Thank you, Chad.
Thank you. That was lovely. But I just have to point out that these three individuals represent 101 years of official service to the county. And we are so grateful for that and really appreciate these very kind words and wish them all well for a very long and very enjoyable retirement. Okay, all right. Well, with that, I will take a motion to adjourn the October 7th, 2021 meeting of the Montgomery County Salary Board.
So moved.
By Controller Sanchez. Second by Commissioner Lawrence. Any board comment? Hearing none, we'll move to a vote. Any negative votes? Hearing none, meeting is adjourned, and we will move into election board.
Okay, I will call to order the October 7th Election Board meeting and note the presence of all three members. Do we have any election board comments? Okay, hearing none, we'll take public comments on items on the agenda, which is limited to 2 minutes. Okay, do we have any general public comment? All right, and then the next up is the approval of the minutes. I will make a motion to approve the September 23rd, 2021 minutes of the Montgomery County Election Board. Is there a second?
Second.
Second by Dr. Arkoosh. Is there any board comment? Hearing none, we'll move on to a vote. Are there any negative votes? Minutes passed. Next agenda item is authorization of changes to polling locations. Dory Sawyer.
Hi, good morning, Commissioners. I'm here today to request the authorization for the relocation of 8 polling places for the 2021 general election to take place on November 2nd. The Board of Elections is given the authority by the Election Code to relocate polling places as they see fit, and today I'm seeking the approval of the board to relocate 8 polling places.
Okay, I will make a motion to approve the relocation of 8 polling places named on the attached document titled October 5th, 2021 polling place relocations, beginning with the November 2nd, 2021 general election and continuing for all elections going forward. Is there a second?
Second.
All right, seconded by Dr. Arkoosh. Any board comments or questions? All right, hearing none, we'll move on to a vote. Are there any negative votes? All right, motion passes. Do we have any closing board comments? All right, hearing none, I'll announce the next meeting of the election board will be Tuesday, October 12th, 2021 at 12 p.m. And I will make a motion to adjourn the October 7th, 2021 meeting, the Montgomery County Board of Elections. Is there a second?
Second.
Second by Dr. Arkoosh. Any board comment? Hearing none, we'll move on to a vote. Are there any negative votes? Meeting adjourned.
Thank you.
Thank you.